Fistulas are abnormal connections between organs or vessels that are not normally connected. They can form between various parts of the body, including the digestive tract, urinary system, and skin. There are several types of fistulas, categorized based on their location, such as enterocutaneous fistulas, between the intestine and the skin, rectovaginal fistulas, between the rectum and vagina, and vesicovaginal fistulas, between the bladder and vagina. The causes of fistulas can be diverse, including trauma, surgical complications, infections, inflammatory diseases like Crohn's disease, and malignancies. Certain medical conditions, such as diverticulitis and ulcerative colitis, increase the risk of fistula formation. Risk factors for developing fistulas include a history of abdominal or pelvic surgery, radiation therapy, inflammatory bowel diseases, and chronic infections. Symptoms of fistulas vary depending on their location, but can include abnormal discharge, recurrent infections, pain, and inflammation. For instance, an enterocutaneous fistula might present with drainage of intestinal contents through the skin, while a vesicovaginal fistula may cause urinary incontinence and recurrent urinary tract infections. Treatment options for fistulas depend on their type, location, and underlying cause. Conservative management includes nutritional support, antibiotics, and wound care to control infection and maintain the patient's overall health. In cases where conservative treatment is insufficient, surgical intervention may be required to close the fistula and restore normal anatomy. Surgical management of fistulas involves careful preoperative planning, including imaging studies and possibly endoscopic evaluation to assess the fistula's extent and complexity. Surgery may involve direct repair, resection of the affected area, or the use of tissue flaps to close the fistula. Postoperative care focuses on monitoring for complications, ensuring adequate wound healing, and providing support for any underlying conditions that may have contributed to fistula formation. Nursing care plans for patients with fistulas involve comprehensive patient education, symptom management, and emotional support. Nurses play a critical role in teaching patients about wound care, managing drainage, and preventing infections. They also provide emotional support, helping patients cope with the physical and psychological impacts of living with a fistula. Regular follow-up is essential to monitor for recurrence and manage any ongoing complications. Proper nutrition, hygiene, and adherence to medical advice are crucial components of effective long-term management. Subscribe to us for more videos like this and visit bazaarbiblio.com for notes and free PDF books. Thank you.